Hello, my name is Martha Walters and I'm going to talk to you today about life as a medical student, and at the end I'll also go through some interview tips. If anyone has any questions, please let Maxine know and she'll then let me know. So I assume that you're watching this talk because you're applying for medicine, or maybe you're just thinking about medicine at the moment. So it'd probably be good to know what you're getting yourself in for. And I've got to say, it's a lot of early mornings. A lot of the time you'll be in hospital and you'll have to get there for the 8 a.m. ward rounds. So a lot of early mornings are in store for you. And also a lot of revision and time on placement, so within the hospitals. But also you've got time to enjoy yourself, explore the city that you'll be finding yourself in. You've got time to sort of pursue other aspects such as some arts, or you can join societies, and you've got lots of time for sport as well. So your time won't be 100% revising all the time, don't worry. So a little bit about me. So I'm from Pembrokeshire, I'm 25. I did a medical pharmacology degree in Cardiff and I've graduated from that. And I've gone on to the graduate entry medicine programme in Cardiff. So I'm currently a fourth year medical student in Cardiff. I've been working as a COVID vaccinator and I also work as a healthcare worker in Glangwili on bank. I've joined the Oncology Society and the Wilderness and Expedition Medicine Society in Cardiff. I'm currently doing a project in paediatrics in the Grange Hospital, which is the hospital which is just north of Newport. I'm a keen runner and I do aerial fitness as well. So like I said, I'm a medical pharmacology graduate. So I'll just talk a little bit about pharmacology. So the class size is now 32, but when I did it, it was 20. So there is scope for that to increase or decrease. You have a shared first year with biomedical sciences. So you have a few sort of common topics between you. So that could be sort of organic chemistry, anatomy, things like that. And then 16 of you can do the anatomy module in year 2. So you've got to sort of say in your first year that you want to do the anatomy module. You need to get 60% overall in the first year to do anatomy in the second year, and you need to do the anatomy module to then go on to the graduate medicine programme within Cardiff. So those are just things to keep in mind from the start. You need 60% again in your second year to apply for graduate entry medicine. And you cover lots of things in pharmacology, such as immunology, neuropharmacology, cardiology, endocrinology. You look at drug development, you look at the research behind different medications, you look at normal body physiology, so that's how the body normally works, and then you can look at pathophysiology, which is when the body doesn't work as it should do. And so this is the basis behind how the body works in general, how diseases happen. You can look at different diseases, such as you can look at heart attacks, so myocardial infarctions, and then you can look at the medications that you could use to try and treat that. So you can look at how aspirin works and things like that. So I really enjoyed my pharmacology, and I would definitely say that if you like pharmacology, then you would like medicine as well, and vice versa. If you like medicine, you would also like pharmacology, because they're so interlinked. So pharmacology is more of the sort of knowledge behind why things work and how things work, and then medicine is the actual application of that. The course now, you have a year in industry, and that's free for your choice to choose what you want to do or what you're interested in. And in your final year, you have that dissertation, but in pharmacology, it's a research project. And that gives you time to have a look at something that really interests you. And it also gives you lab experience as well. So I did mine in immunology. So I looked at a certain type of cell in your immune system called T cells, and I was looking at a certain protein on that cell and to see if we could modulate that protein somehow to enhance your immune system to fight off cancers and to fight off viruses. And actually, really interestingly, it's been looked at to see if we can modulate that, and in regards to COVID as well. So I still have sort of links with my research team that I was with in my final year of pharmacology. So if you go down the graduate entry medicine route, you have started your medical pharmacology or whatever degree you've decided to do, and then after your second year, you need to start thinking about applying again. So that includes your personal statement, going through UCAS, and then having a look at whether there's interviews, whether they're in a panel format or multiple mini interviews, as a lot of them are these days. But also, if you're a graduate, you need to think about the GAMSAT. So the GAMSAT is an exam, it's a written exam, and it's similar to the BMAT, but it also has some similarities to the UKCAT as well. So in the GAMSAT, you have 3 aspects to it. Your first one is your reading and your understanding. So they'll give you passages to read, and they'll ask you to make sort of deductions from that. The second part of the exam is to write an essay. And then the third part of the exam is looking at your science, your maths knowledge. So it encompasses everything, and what it's based to do is so that everybody is at a certain standard before you start the graduate entry course. Because if you haven't done A levels, or if you've done something which isn't science based, such as maybe fashion or an art course, they want to know that you've got a certain level of scientific understanding. So if you haven't done science A levels, that's absolutely fine, or if you haven't done a science degree, that's absolutely fine. This is just an exam to sort of bring you up to a baseline, so that they know where everyone is before they start the course. It is quite a long exam, and you do need to set some time aside to revise for it, but don't worry about it too much. The main thing to think about is when you're going to sit it, because you can choose when in the year you want to sit it. I sat it at the end of the summer of my second year, so just before my third year started, and that gave me time in the summer to just dedicate to the GAMSAT alone. So just keep in your mind, if you are planning on doing graduate entry medicine, keep in your mind about the GAMSAT and when you want to do it, because you don't want to forget about the GAMSAT and then have that alongside your other exams in your course. So just keep an eye on that. So I applied in my second year of pharmacology for the graduate entry medicine programme. And then in the summer of 2018, I graduated, and then I started medicine. So because I'm doing the graduate entry medicine course in Cardiff, I'm going to mainly speak about the Cardiff course. However, there are similarities with other courses. So just do your research on the unis that you're applying to and see what sort of course they offer. So in Cardiff, they have a spiral curriculum, which means you revisit topics, the same topics in different years of the programme. It's mainly focused on that revisiting of previous knowledge. So you can build on your knowledge each year. They also do case-based learning as well, which is a bit different to problem-based learning, which I'll speak about in a bit. So in the first year of the Cardiff Medicine course, you have shared teaching with the biomedical sciences. So that's very similar to the first year of the pharmacology degree as well. You have an introduction to case-based learning, which I'll talk about in a bit. And you have some clinical skills sessions and some GP placements. So your patient contact starts very early in Cardiff. I skipped the first year because I did the graduate entry, so I went straight in at year 2. So in year 2, you mainly have case-based learning, and you have some hospital placements and clinical skills sessions. So that patient contact is at the forefront of Cardiff. Some universities have three science years and then 3 clinical years, so it's very split in your patient contact. So I think that's another thing to think about as well when you're applying for medicine, whether you would want to have patient contact from the start or whether you'd want to try and get a science knowledge base first and then see patients. In my view, for me, I think patient contact at the start is quite important, because one of the main things about medicine is your communication and your people skills, and I think that's just something that you have to continuously build on, and early exposure to a clinical environment and to seeing patients is very valuable with that. I think that is a really important point, but you've just got to see what works best with you. So yes, in year 2 you have some hospital placements and some clinical skills. So clinical skills include sort of taking bloods, giving injections, that sort of thing. You also have a progress test, and so that's a test that's 3 times a year, and it's just to monitor your progress. So you have the same exam that year 3, year 4, year 5 sit, and you're just expected to get a higher percentage of it correct each year. And in year 2 as well, you've got a multiple choice question exam at the end of the year, and you also have an ISCE. Now, an ISCE is an exam that's in person, so you will go in and you'll have an actor there or a patient, and you'll have an examiner, and they're examining you on your communication skills, so whether you can speak to the patient effectively, whether you can gain a full history from the patient so you can find out what's been going wrong. They'll also look at your examination skills, so you'll have to examine the patient or the actor as well, and they'll also look at some clinical skills as well. So they'll look at your technique for taking bloods or your technique for your injections, just to make sure you're safe. You have an ISCE in your 2nd year, and also in your 4th year you have an ISCE. And you also have a 1-week-long SSC. So an SSC is a student selected component. So anything you're interested in, you can look at further within the Cardiff Medicine course. So you have a 1-week-long student selected component in year 2. So you can pick absolutely anything. So I did life drawing in my 2nd year. It has to have some basis towards medicine, so I did life drawing with a view of looking at the anatomy behind sort of the human body, and I'll talk about that in a bit as well. But as you go further through the course, you have a longer and longer student selected component. So in 3rd year I was working with that sexual health centre, and I was doing an audit, so I was looking through sort of patient details and making sure that people who should have been tested for a certain bacteria were actually tested for a certain bacteria in accordance to the guidelines that we're all meant to follow. So I was just doing an audit or service evaluation of that. I'm currently doing my 4th year SSC at the moment, and I'm in paediatrics with that, and I'm looking at the number of head scans that children have had, and looking also at the effect of any radiation or the exposure to the radiation that those children have had. So the scope is huge. You can look at whatever part of medicine interests you and just investigate that further. And as you go through the years, you have more placement, you've got more time in hospital, and that sort of transition at the end then with your final year, you can shadow the junior doctor that you're going to do their job afterwards, if that makes sense. So if you're in Cardiff Uni, if you're in your final year and you decide that you want to be in Wales for your foundation year jobs, so your first job after you finish medicine, you can actually, as part of the course, you can shadow the person doing the job that you're going to do, so it sort of has a seamless transition then. Also, in your 5th year, you can have an elective, so you can travel anywhere in the world that you want to for 8 weeks to have a look at a part of medicine that you're really interested in. So I'm starting to plan that for myself now, and I'm thinking about maybe going to Greece and going to the refugee camps there and trying to help out there. But other people have gone to India, have gone to Peru, so you can really go anywhere and just follow what interests you. So talking more about the case-based learning, so this would be in the 1st year and the 2nd year of Cardiff Medicine, but other universities use case-based learning as well, and it is a bit different to problem-based learning. So in Cardiff you have 2-week blocks, you have lectures on the subject, on that specific subject that you're going to do, you have small group sessions, and you analyse and go through a case as a group. So say for example the case was somebody who'd had a cough for 4 weeks, your lectures would be about respiratory, your lectures would have a respiratory base to them, so it would look at normal physiology, so your anatomy of the lungs, how the lungs work normally, what happens in diseases, and they'd also teach you a few different diseases which affect your respiratory system. You then have your small group sessions going through a case about this person with a cough, and you'd think about all the things in that case that you would want to ask more questions on, things that you'd want to know more about, ethics questions as well. So you do have a lot of information in those 2 weeks, and what I quite like about it as well is that you're studying, say you're studying the respiratory system, you'd have a look at the anatomy, the physiology, you'd look at different diseases, and you're covering just respiratory in those 2 weeks. You also have your Wednesday afternoons off for sport as well in your first couple of years. So that was a typical timetable of what the first week would have looked like. And now this is an example case. So this is a very short one that I've come up with just to speak to you today about. So in this situation, you're a GP. So Mrs. X is a 40-year-old lady. She's come to you with tummy pain that's gone on for 5 months. She doesn't speak English, and she's brought her 11-year-old son to translate. The pain is described as sharp, and it comes on in short bursts after eating. She's allergic to penicillin. She smokes 20 cigarettes a day. So then you would be in your small group, and you would analyse this and try and think of all of the different factors of this that you can. There are no wrong answers here, even if your sort of annotation to the case would be you'd want to know more about this specific factor. You would analyse this in your group. So I'll just give you a moment, and then I will go on to what I've analysed on this. So this is what I've come up with for this. So I've firstly picked up on the tummy pain. This is quite vague. You need to pinpoint where the pain is, because she might describe a tummy pain as pain that's really high up. It might be a pain that's really low down. It might be a pain that's everywhere. It might be on one side or it might be on the other, because you need to sort of relate this to your anatomy as well, where your different organs are. If it's high up on your right side, that's where your liver and your gallbladder is. If it's lower down and it's on maybe your right side, that could be more appendix-like. If it's everywhere, you also need to think about bowel as well. You also have your kidneys, so that would be a pain more in your back. So you need to think about this tummy pain, and it is vague, so you need to try and pinpoint where the pain is to give you more of a clue of what's been going on. She also says that it's been going on for 5 months, and you'd want to know whether this is getting worse or whether it's getting better. Why hasn't this lady presented before 5 months? Were there any factors in that? The next point is that she doesn't speak English and she's brought her son to translate. You need to think about how reliable is this translation going to be? Is the son able to translate properly? Is the son going to be able to translate certain terms? Would he know the words for different parts of the body? And you also need to think about, as well as this lady has come in with tummy pain, you need to think about whether you need to ask about any of her reproductive history and whether it's appropriate for her son to translate. So you can also think about getting a translator available to you. So there's lots of different services for this, and actually one that a lot of GPs use is a telephone line that you'll call up and you'll get a translator over the telephone, and they'll be on speaker and they can translate the conversation for you. She then describes the pain as sharp and it comes on in short bursts after eating. And this is sort of quite stereotypical of gallstone. So that sentence there sort of puts that thought in your mind. She also describes the pain, so as sharp. You'd want to know how long that lasts for, whether she has any other symptoms at all, whether there's any sort of problem with her bladder or her bowels. You'd want to know how severe that pain is, so on a scale of 1 to 10, with 10 being the worst pain you've ever experienced and 0 being nothing, where on that scale it is. So there's lots more questions you want to know about this. Also says she's allergic to penicillin. With any allergy, you want to know what they're allergic to and what happens when they have it. So do they have a rash, or do they have an anaphylactic reaction, which is where you can get swelling of your tongue and your throat and it's an emergency. So you need to find out what happens when they have the thing that they're allergic to. Also says that she smokes 20 cigarettes a day. So with this part of the case, you need to think, what conditions is she more prone to now that you know that she smokes 20 cigarettes a day? You also want to know how long she's been smoking for. And you can use this opportunity to give advice to her about smoking cessation, or to give support about cutting down on smoking as well. So this is just an example case for you to sort of see how the case-based learning is. So I hope that's been helpful for you. So just going through a bit about your exams. So in Cardiff, in your first and second year, you have a multiple choice exam. You also have progress tests as well in Cardiff Uni, and then every medical school in the UK will have either an ISCE or an OSCE, where you are assessed sort of on your practical skills of medicine. In your final year as well, then you'll have a prescribing exam and a situational judgment. So the prescribing exam is what it says on the tin, really. It's an exam to make sure that you're safe when you're giving prescriptions. So you know the dosage to give people and what you need to give people for certain conditions. So it's mainly a safety test. The situational judgment as well is more ethics, so you can get questions such as you've noticed you're on a ward round, you've noticed that the consultant has come in and they smell of alcohol, what do you do? And then they'll give you options such as speak to the consultant in front of the patient or other members of staff, and another one would be take the consultant off to a side room and ask them about their alcohol use. and another would be to consult a colleague or consult a senior colleague. So out of those three options, you'd have to pick which is the most appropriate. So I hope none of you thought the first option was the most appropriate with that. But the situational judgment is just a test to look at how you would best approach certain situations which could theoretically arise. And I think it is a bit similar to some of the questions that come up in the UK CAT. But don't worry, those are in your final year. So going back to the student selected component, so for my second year I had a week-long project, and I did life drawing for this. So these are some of the drawings that I did, and I did it sort of with a look at the anatomy behind the body. So that's why I sort of included elements of the heart and the ribs and the vertebrae. So your SSC project can be anything that you want it to be. Any interest that you have, you can develop that further. It needs to have some basis towards medicine, but you really do have the scope to look at whatever interests you. So medicine does give you a lot of opportunity to follow your interests, and if you are interested in or have certain hobbies before you go to uni, please continue them. You do have time to do that, and you've got scope within the course as well to look at it further. So you have a lot of placements in medicine, so this is where you can learn on the job. You learn how to be a doctor by shadowing doctors, joining in, helping them out. So you can go on ward rounds, so you go around and you see every patient in the morning, a quick overview of what's going on. You can examine patients, take histories from them, practice your clinical skills, so taking bloods, doing an ECG which looks at the electrical activity of your heart, and if you've watched any of those medical dramas, it's when they've got all the leads on their chest. You can also help out in surgery if you've got a surgeon that's willing to let you help. So I've helped out in quite a few cesareans, and yeah, so I would say when you're on placement, definitely introduce yourself to all of the team there, and show that you're interested, and then all the opportunities will come your way. You have teaching throughout your placement, so you get bedside teaching, so that will be you'll go see a patient with one of the doctors, and they'll teach you as you go and as you see the patients. You also have your case-based learning throughout, so you'll have a few cases throughout your placement just to make sure that you're covering all the topics that you need to. And it also gives you an opportunity to move around and explore new areas. So in Cardiff Medical School, they can send you all over Wales. So on my placement, I have been to Wrexham in North Wales, I've been to Haverfordwest, so I've been to Withybush and Carmarthen, so Glangwili. You're put up, you've got accommodation given to you for free, so that's absolutely fine, don't worry about that. And then around Cardiff, I've been to sort of Newport, I'm going to Merthyr next year, and I've been to the few different hospitals in Cardiff. So it is quite nice to get a feel of different hospitals and different work environments. And also it's nice to go different places, so you're not just in Cardiff the whole time, you can go out somewhere and be closer to the beach. Yeah, it's quite nice to be given the opportunity to explore a new area. So it doesn't stop once you've finished your medical degree. So after you graduate, you then join the foundation programme. So this is when you're a junior doctor. So F1 is foundation year 1, F2 is foundation year 2. So F1 and F2 are the minimum requirements for your junior doctor. However, you can do an F3, F4, F5. So this is gives you scope to work at an F2 level and work at F2 jobs, but you don't have to sign up for further training. You could work abroad if you wanted to, you've got time to travel. So there's lots of flexibility within medicine. After your junior doctor years, then you can go into your core training, which is down a surgical route. You can do specialist training or GP training. So GP training can take minimum of 3 years really. So you'd have 6 months in paediatrics, 6 months maybe in A&E. And then after your specialist training, you can be a registrar, and then you can do further training then and get to consultant level. But however, there's lots of different paths within medicine. I've got a friend who is going straight into the Navy once she qualifies. So her F1, F2 years, she'll be with the Navy working with them. I've got another friend whose aim is to work for the World Health Organization. So she's looking at routes into Public Health England, and then wants to go further and go into the World Health Organization. So there's lots of different career opportunities for you. So it's not just the straightforward junior doctor, registrar, consultant. You can make it whatever you want it to be. So medicine does differ to other courses. You're held to a different standard than other students. Your behaviour has to be professional at all times. You're representing a medical profession at all times, so that includes your time within a hospital, that includes your time within university, that includes if you're on a night out or if you're in your university halls. You are held to a different standard to other students, so I'd just say to just keep that in mind. The course is regulated by the General Medical Council, and that's true of every medicine course in every UK university. You do have a different style of teaching and learning to other courses. Some other students might have 1 or 2 hours of contact time each week, but you might be in 9 till 5 most days, because you will have a higher face-to-face teaching time, and your terms are a bit longer. You have longer days to other people in university, and you have your exams at different times in the year. So I would just keep that in mind as well. But you meet so many people. You will meet people on your course, people in your halls, and there's so many opportunities to meet new people and try new things. Medicine, it's a fun course, and to do medicine as well, like, people know that it's a caring course, and it's full of people who want to care and want to help others. So there's lots of friendly people there, so you'll definitely make friends, so don't worry about that, and you will enjoy it. I've loved it, so you will definitely enjoy it. It is a fun course, and you've got lots of time to explore interests and to try new things. So just going back again about medical pharmacology, or another one is biomedical science degrees beforehand. They are really important and they're really useful. It can help you with your medical knowledge. It teaches you how and why things are as they are. And so that understanding and that scientific knowledge will then help you when explaining to a patient about their condition, or explaining to a patient about what medications they're on and why they're on those medications. So that extra bit of understanding really goes a long way. It helps you with your medical degree as well, because there is a lot of crossover. You get extra points when you apply for your foundation programme by having a medical pharmacology or a biomedical science or another degree. However, that is all changing at the moment, so it might be changed by the time that you graduate. But one of the main things was, when I was applying pharmacology, I was thinking, gosh, I'm going to be so much older than the other people on the course. I won't fit in as well. I won't make as many friends. But it really doesn't matter. So I went in slightly older because I'd done a degree before and I went into medicine. But actually, you don't feel older. You make friends with the people on your course. It's not actually that big an age gap, even though it might feel it in your mind. You might feel that you're a lot behind other people, but actually you're really not. You've just gained more knowledge, you've gained another degree, and you're going in to do medicine, and you'll be able to make friends with people on your course as well. So please don't worry about that. Also, another benefit is that in Cardiff, so I did both my pharmacology degree and I'm doing my medicine degree in Cardiff, I know the lecturers. I know them on first name terms, so that's really nice to have that sort of continuity with the lecturers, and that also then gives you other opportunities as well. If there's some of your lecturers before that maybe have asked you to be involved in some research, you might be able to continue that research, and then you can publish papers and present research, and all of this goes on your sort of academic CV, and it really boosts your applications for in the future when you're looking around for jobs as a doctor. So just keep that in mind as well. So in most medical degrees as well, you get an opportunity to intercalate. So if you applied to do medicine, but you've actually thought, oh, I really would have loved to do pharmacology, but I've gotten into medicine now and I'm going to stick with that, you have an opportunity to take 1 year out of your medicine degree to go do a Bachelor's of Science, so a 1 year degree in another specialty, or in another you've got a 1 year out to do another degree. So you could take 1 year out, join the 3rd year of pharmacology and do a pharmacology degree within 1 year. Other common topics are medical education, psychology. EPIC is quite an interesting one, which is emergency, pre-hospital and intermediate care. So you'd have 1 year based in A&E, with the ambulance service, with mountain rescue, or with the air ambulance. And you'd get a degree in 1 year, and you can also do sports science as well. And this can be all over Wales as well. So if you do have your medicine place and you think, oh, I would have liked to do some psychology, or I'd have liked to do pharmacology or sports science, you have the opportunity to do so. Another aspect where a lot of medical schools differ is anatomy. So I think Cardiff, Keele and Dundee have dissection. So you'd have a cadaver, you'd have a body to dissect to teach you anatomy. Other universities such as Birmingham have pro-sections, so just pre-dissected anatomy to sort of show you what things look like, that sort of thing. So a lot of the medical schools are very different in their approach to teaching anatomy, and in Cardiff I found it very useful to do full body dissection because it teaches you what everything looks like in a sense. So you can see what arteries and veins look like, you can see how muscles and tendons attach, you can see how the spinal cord works and sort of the body anatomy. But every university is slightly different, so when you're applying, just have a look at how that medical school teaches it. So a big thing with universities is whether it's case-based learning or problem-based learning. Now there are other types of teaching in different universities, such as case-led or small group teaching, or a different technique altogether. However, the main two that you'll probably be wanting to know about is case-based learning or problem-based. my sort of top tip for this would be to have a look at the medical schools that you're applying to, see how they teach you, and definitely before your interview, look at the pros and cons of their teaching methods. And specifically, I'd say to look at the differences between case-based learning or problem-based learning. Now, I'll go more into problem-based learning on the next slide, but just to sort of recap, earlier on in this talk, we did a little bit of the case-based learning, and we spoke about how that goes ahead. So now I'll talk a little bit about problem-based learning. So I haven't done any problem-based learning, because my course is case-based learning. However, this is information that I've got from the Medic portal. So with problem-based learning, you have more self-study. The lectures are less structured around the learning outcome. And in your problem-based learning, you're in small groups, so similar to case-based, and you're presented with a problem. Your group brainstorms different reasons or different solutions for this problem, and you need to decide what you need to learn in order to solve the problem at hand, and those are your learning objectives that you need to learn about. So you have to come up with your own learning objectives based on sort of the scenarios and based on what you've brainstormed around the scenarios that you've been presented with. And then at the end, then after you've done some research, you go and you present your findings to the group and your facilitator to compare notes. It is very similar to case-based learning. However, my general understanding of it is that the problem would be a specific disease. So it would be more like you would have to think about gallstones and then study about gallstones and then the treatments for gallstones. So it is more focused on the problem, whereas case-based learning is looking at the case as a whole. But please don't quote me on that. Do your own research about case-based learning, problem-based learning, and universities change how they teach all the time. So if one year that they're teaching case-based learning, the next year they might have swapped to problem-based or something else altogether. So do your research on the universities that you're going to apply to. And just to sort of come to the end of the talk about medicine, your life won't completely be just the course and just your placement hours. You do have time for a life outside of that. University life is fun. There's lots of different societies that you can join or sports clubs that you can join. So I've joined the rugby club in my first couple of years. So that's a photo in the corner of my time with them. I've also done aerial fitness as well. So that's something especially that I think, coming from Pembrokeshire, you don't have that much opportunity to try some things that are sort of a bit wacky or a bit out there. So going to the city, wherever you go, there's going to be lots of opportunities to try something new, and I would really, really encourage you to put yourself out there and try different things and try new things, because you might be surprised in what you like. Also with societies, there's opportunities to look further into a topic that you enjoy. So one of my friends has set up the Welsh Heart Society, and their aim is to teach everybody CPR. So if you find somebody in the street who's not breathing, how to treat them. So you could do chest compressions and calling an ambulance, and it teaches people. I hope you know the Doctor's ABC. If not, have a little Google of it. It is really important for everyone to know. So you can get involved in societies such as Welsh Hearts, which teaches people how to save lives, really. So there's lots of scope to look at whatever you're interested in. So common misconceptions about medicine is that firstly, you can't have a social life because you're going to be so busy, you'll be revising all the time, you'll be working all the time. And even though it's true that you do have to revise and you'll be on placement a lot, you definitely can have social life. You can have that proper university experience and trying new things and meeting new people. You can definitely have a social life, so please don't worry about that. You also definitely have time to do sports. They put time aside in your first couple of years for Wednesday afternoons for you specifically to do sports. So please don't worry about that as well. Also, a common misconception is that you're not allowed to do much until you're qualified, and it's completely the opposite of that, actually. A lot of the times you'll go to the wards and they might be quite short-staffed, or the doctors would be really busy, and you can actually be really helpful, and you can just turn up and say, I'm here to help, is there anything that I could do to help you? And they might say, oh yes, this lady or this gentleman needs bloods, would you mind taking them? Or would you be able to go and examine this lady? So you can help out quite a lot, and you can do a lot as well. And another misconception is once you're qualified, that's it, you're done, you've got your degree, then you can just go be a doctor and not do any more teaching or any more learning. And that's completely wrong. Medicine is continuous. Once you finish your degree, you are still going to learn. There's going to be new things coming out about different diseases or different treatments all the time, and you've got to continuously be learning and also help teach others as well. It's part of the course, and it's part of the whole ethos of being a doctor, is you teach as you go, whether that's teaching patients or whether that's teaching medical students who might be on your ward. So I hope I haven't put anybody off applying for medicine. I have really enjoyed my medical degree. I also really enjoyed my pharmacology degree, and I actually wouldn't have had it any other way. I loved my pharmacology, and it's given me a good scientific background and scientific knowledge, which underpins my medical degree, and I find that it helps me a lot in day-to-day life with explaining to other colleagues, explaining to patients about how certain things work. So I have absolutely loved doing medicine. I think it's such a worthwhile degree. You've got time to explore anything that interests you, and you can really tailor it to what you want it to be as well. I think as well afterwards your sort of career opportunities are numerous, they're endless. You could do whatever you want to do and whatever you put your sights to. So I would definitely encourage applying to medicine. I think it's really fun, it's really rewarding as well. If anybody has any questions, let Maxine know and she can contact me. So thank you for listening. What I'm going to do now is I'm just going to run through a few interview tips. And that will mainly be focusing on multiple mini interviews. But these are things that could be relevant to panel interviews as well. So, top tips. Always say hello, give a smile, and introduce yourself. Know the course as well. So when I was speaking about problem-based and case-based learning, always know what course it is and how the course is structured of that particular university. Also, keep an eye on the news. Have a look at what's been going on. Obviously, with COVID, that's been a massive impact in healthcare, and it's been on the news all the time. So just keep an eye on updates and things that are going through. There will be questions on ethics and resilience, and if there's a maths station, just go through a few basic sums beforehand, such as how to work out concentrations and things like that, because in the heat of the moment and with the pressure of the interview, you might find that your mind goes blank, and that's fine, that's absolutely normal. But I found just going through some basic sums beforehand makes you that little bit calmer when you go into the interview. Check the medical school's information on their interviews and how they interview. There should be information up there on what they're trying to gauge from the interviews, what they're looking for, and what sort of thing they'll be doing. So that's whether it's multiple mini interviews or panel. Definitely have a look at Tomorrow's Doctors and the General Medical Council criteria. And mainly, don't let other interviewees stress you. You deserve your place. You've earned your spot. You have gone through the application progress. They've read your personal statement. They've had a look at your academic CV, and they have thought that you are worthy of a spot in their medical school. Do not let other people stress you out by maybe other people coming up and sort of saying all of these things that they've done. You have earned your place there and you deserve your spot. So please have the confidence of that. So popular questions which almost always come up are why medicine? So this is one that you actually have a chance to look at beforehand and to really think about how you're going to answer this question. Try and make it seem natural and that you're not just reading a script, and make it very personal to you. Why do you specifically want to do medicine? And a follow-up question might be, why not nursing? And I think a really important point to make is that nursing and medicine are very different, although there's a lot of crossover, but these are two teams that have to work well together for the benefit of the patient. Nursing is very hands-on. It's at the bedside of the patient. You're continuously monitoring and caring for that patient, which is so important. Medicine, you've got more of a sort of detective-like approach. You need to figure out what's going wrong, why something's been going wrong, how can we then treat this patient, what's the best steps from here. And a lot of it might not be at the patient's bedside. A lot of it might be doing some paperwork or looking at scans and things like that, or communicating with other doctors to try and get the best treatment for your patient. So I think you really need to go away and have a look at what medicine is, what being a doctor is, and what nursing is and being a nurse is. I think that's really important. Another popular question is to tell them about a time where you faced a difficult situation and how you dealt with that. So that is looking at your problem solving. It's looking at how you face tricky situations, because there are going to be tricky situations in medicine. And all they're wanting to know is that you were able to overcome this tricky situation in a logical manner, in a calm manner, and also what you learned from it as well. Another one is to explain a time where you showed leadership and teamwork. Again, this is because there's lots of leadership and teamwork in medicine, and resilience as well, because it's quite a stressful course. They want to know that you've got good coping mechanisms as well. They want you to know about empathy and the difference between empathy and sympathy, and they'll also probably ask you questions on capacity, confidentiality and consent. One of my tips as well would be, with the question they're asking you, think about what they're wanting to hear. If they're asking about empathy, they want to know that you're a caring person from that question. If they're asking you about a time where you showed leadership, they want you to tell them that you've had this experience of leadership and this is what happened, and if it didn't go well, explain why it didn't go well and what you learned from it. These are the things that they want you to have, and you need to tell them in your answers that you've got those things. Also, don't assume that the interviewer has read your personal statement. Just tell them everything that you put down on your personal statement. Don't assume that they already know it. Obviously make it relevant to the question, but if you've written about maybe doing Duke of Edinburgh in your personal statement, it's absolutely fine to mention your Duke of Edinburgh to the interviewer. Don't assume that they've already read your personal statement. There are a few sort of, in quotation marks, trick questions that you hear about sometimes. One of them might be something like, what do you need to consent for? And your mind might jump straight to, if someone goes to surgery, you need to get consent that that's what you're doing. But as a whole, you need consent for everything. As a medical student, you need consent to even go and speak to a patient. You need to go and ask them, explain you're a medical student, and would it be okay for you to speak to them, or would it be okay for you to examine them? You need consent for every single thing that you do. Another question that somebody has told me that they've had is they were asked sort of offhand, would you make up a bed on a ward? And some people might think, oh no, it's not the doctor's job, it's just one of the healthcare assistants would make up a bed. But actually, you are going to do, as a doctor, anything that is in the best interests of your patient. If that means making up a bed, that means making up a bed. You are there for the best interests of that patient. So just think back on that as well. You want to work in the best interests of your patient, and any question they ask you, think back on that line that you're there to do whatever is in their best interests, and that will help you through a lot of the interview. Also think about ethics as well. Probably think about the question that they've asked you and how they've phrased it too. So keeping up to date with the news is really important. So this is quite relevant for COVID times. Keeping up to date with what's happening with COVID, with the vaccination programme, things like that. However, there's also quite a few new ones, such as the movement of face-to-face consultations to Skype consultations or phone calls. And what they want you to do with this, they just want you to weigh up the pros and the cons of both. You don't have to make a decision. You can explain the pros and the cons, and you can say you can see both sides of each argument, and then explain to the interviewer what each of those arguments are. Also have a look at public health as well. I had the BBC News app on my phone, and you can put on your favourites health, so all of the health topics I can see on that BBC News app, so it just keeps you up to date. Also as well, there is a big crisis with mental health at the moment, and may have been going on for longer than we realise as well. So that's another topic that I would say to have a read up on. In some of the interviews, they might show you a photo, and they might say, look at this photo, describe it to me, think about associated healthcare implications. And what I would say is to just do what it says on the tin. First of all, it says describe the photo. So with this, I'm going to describe it. This is a photo of what looks like a seaside town. You can see that there's a lot of boats, that there's a beach there, and you can see the lifeboat station and things like that. You can then from that say, this looks like it's probably a tourist destination. So perhaps you might have an increase in injuries or traumatic injuries such as falls, or you might have an increase in people who maybe come down on holiday and having heart attacks or strokes and things like that. So you might have an increase in patients in the summer months, because this is a seaside destination, so you'd have more people there in the summer, so therefore you'd have more patients. You can also think as well that it's a coastal area, it's a seaside town, it's probably quite rural. It might be a while to get to your GP or to get to your hospital. So then you need to think about access to healthcare. Would somebody who doesn't drive be able to go and visit their GP as easily as someone who does? And also in the photo rounds as well, you can think about whether areas might be sort of less well off than other areas, and what does that mean for healthcare as well. But with these rounds, if it says describe the photo, please describe the photo as a whole before going into specifics. So you might get a photo like this and you're thinking, oh, I need to try and diagnose this medical condition. But what they've asked you to do is to describe the photo, and they don't actually need you to have any medical knowledge at all. What they're doing is they're testing your communication skills. They're seeing if you can describe to them what is on the paper. So if you have a described photo, it might be good to imagine that the examiner can't see the photo that you've got, and you've got to describe it well enough for them to do a drawing of what you've been given. So with this, I would say it's a photograph of a pair of hands. Those hands are palms down. There's a ring on the fourth finger of each hand, and the fingers are splayed outwards. You can then obviously go into more detail, but they want you to say the obvious. Describe the photo, you need to say it is a pair of hands. A lot of people will go straight into, you can see that there's that the fingers are splayed outwards. You can see that there's a bit of swelling over the knuckles, and what they'll have missed is actually just saying that there is a pair of hands in this photo. So please read the question, listen to the question, describe the obvious. What they want to do in interviews is to know that you can communicate, that you can speak, and that you are a kind and caring person. So which I'm sure you all are, and you have really deserved your place in your interview, and just show them who you are during your time in the interview. There isn't any right or wrong answers. They want to see your reasoning, and they want to see how you think about certain issues. There's a lot of grey areas in medicine, and there isn't really any right or any wrong, but what they're looking at is to see how you think around a situation, and they want to see your ability for looking at both sides of an argument. They don't necessarily want you to say a certain answer. You can sit on the fence, so please don't worry about that. With lockdown as well, there might be a lot of people who've been able to say, oh, I went and I was a volunteer in the vaccination centre, or I went and I joined and I started working as a healthcare worker, or I started working for this charity. Please don't worry if you didn't go and volunteer somewhere. It's not a must that you have gone and done something. What's important is that you show resilience, because lockdown was a really tough time. It is a really tough time. These year and a half of living with this COVID life has been really difficult. So what they're mainly going to want to know is your resilience, and how have you dealt with this tricky time? Have you helped any friends or family go through it, even if that just means picking up the phone, calling your grandma, making sure that she was okay, or calling friends, making sure that they're okay. That's enough. And obviously lockdown is a lockdown, so people were meant to stay at home and obey the rules. So if that's what you did and you didn't go out volunteering and you didn't work in the hospital, that's absolutely fine. You have helped enormously just by doing that. So just think about, don't try and compare yourself to people who might look as if that they've gone out and they've done lots. It's what you've taken from certain situation or from certain life events. So with lockdown, as I said, if what you did was call your friends, check in on each other, make sure each other's okay, mention that in the interview, and mention what you learned from situations, and that is what they're wanting to hear, and they would love to hear something like that. So sort of going on from that is work experience and volunteering. What you need to show is will and initiative. They don't want you to have gone and have done everything or done something really impressive. A little thing like calling people to check up on them, or to maybe help out on a reception desk in your GP surgery, or for citizens' advice. Little things, well actually they're not that little, but like things like that are really important, and the main thing is to show what you learnt from that experience and what you gained from that. You could keep a reflective diary to sort of help show you what you learnt and from your experiences. And your work experience of volunteering could be absolutely anything to do with helping people or with communication, and you still have time to do some volunteering or work experience, but please don't worry if you weren't able to. It has been a difficult time. But if you weren't able to, think about what you have been doing in this time, because I'm sure all of you have been checking in on friends. I'm sure all of you have been making sure that sort of family is okay, or maybe you might have helped somebody with a food shop. All of these things are really relevant and really important. So just have a think about what you've actually done in this time, because I'm sure it's more than you think it is. So again, thank you very much for listening to me today and to listening to this talk. I really hope it's been useful. If you do have any questions, please speak to Maxine, and then Maxine will pass them on to me. But all the best in your studies at the moment and applying for medicine, and hopefully I'll see you as a doctor shortly.